Chargers running back Najee Harris was helped off the field after suffering a very serious-looking injury to his left lower leg here on this play. And Cowboys wide receiver CeeDee Lamb is very lucky he did not dislocate or break his ankle on this play. Welcome back, everybody. I'm Dr. Brian Sutterer, and the goal in this channel is to teach more about the medical side of the sports world. We're going to be talking about two pretty significant-looking injuries, obviously one more so than the other, that just happened earlier today in the NFL. Also, yes, we redecorated the studio a little bit here. Let me know what you think. Still kind of modifying things, but hopefully you like the new look. Let's talk first about Najee Harris. I think everybody could see the replay. I think it's pretty clear what this injury looks like. But I want to look at this side-on view here first to understand the load that's going to be put through that Achilles, put through that gastroc, that soleus, that plantaris complex here. So Harris, we can see he's getting ready to get this handoff. He steps back with that left foot, and this position right here, he is maximally dorsiflexed. So that angle that you see in his ankle, that's dorsiflexion. What that's going to do is it's going to put tension on his Achilles, it's going to put tension on his gastroc, that whole triceps surae complex in the back of his ankle, and it's going to eccentrically load it, because in this position, he's getting ready to kind of pre-tension to preload that calf muscle to then explode off. And so to do that, you have to put it under stretch. Now, unfortunately, putting it under stretch like this, putting it under that eccentric load where that Achilles is lengthening while the gastroc muscle is then going to forcibly try to contract against it, is what puts all that load through the muscle, through the tendon, and leads to this unfortunate injury. Looking at it now from the backside is where unfortunately we see what the exact injury was. Here again, that gastroc muscle, you can see the nice contour, the nice outline. This is going to be about where the myotendinous junction is sitting. We're then going to have the mid portion of the Achilles tendon coming down. So here as he goes to push off, you can unfortunately see that sudden recoil, that snap, that rupture. That's all that energy that's stored in that tendon. Because remember, your tendons are like rubber bands. All that energy being released all of a sudden as the Achilles tendon almost certainly ruptures. Next, we'll dive into our anatomy with the Achilles and talk about what happened here with CeeDee Lamb. But first, I want to give a quick shout out to the sponsor of today's video. Gentlemen, listen up. If you're still wearing your granddad's boxers like these, then you have got to check out the sponsor of today's video, Skims. It's not just women that should get to have comfortable and high quality underwear. And so when I heard that Skims was also offering underwear for men, you know I had to check them out. Skims is all about good fit and comfort. And when it comes to what you're wearing downstairs, obviously those are two things you want to focus on. The Stretch 5-inch boxer brief is my go-to for those more active days. I like having something that's a little bit more snug, gives me a little bit more support when I'm going to be out there going on a run or working out in the gym. But the nice thing about these is they're not going to ride up on my leg, and they feel really comfortable and lightweight when I'm pushing it hard and really working up a sweat. Otherwise, for everyday wearing, their cotton 5-inch boxer brief is perfect for me. Again, it's still lightweight, very comfortable without riding up, and gives you that great comfort and fit that you can appreciate from Skims. So click the link in the description to step up your underwear game today and shop Skims Men's at skims.com. And be sure after you place your order that you check YouTube in the survey at checkout and then select my channel so that Skims knows that I sent you there. It really helps support my page. I know you've probably got some nasty stuff in your closet right now with holes in them, so what better time than to throw those in the trash? Click the link down below and check out Skims today to help support my channel as well. Looking at our biodigital anatomy tool here, I've highlighted that Achilles tendon. And of course, the Achilles tendon is going to be the combination of really three different muscles and tendons that come together. First is going to be the gastrocnemius. That's the calf muscle on the backside. The medial head, the lateral head of the gastrocnemius coming down to form this myotendinous junction where the muscle meets the tendon. On the deep side, you're going to have the soleus. That's the muscle that sits deep directly underneath the gastrocnemius. And then you're also going to have the plantaris, which is a really thin little muscle that originates up by the knee and comes down in this pathway as well. The primary area that's often ruptured with the Achilles is this mid portion of the tendon. We call it a watershed zone. There's not as good of blood flow in this area, and so there tends to be a little bit more pathologic tissue, a little bit weaker tissue, tends to be kind of that weak spot in that whole chain where we unfortunately will often see the injuries. Now, you can have a rupture off of the bone. It's part of why we always get x-rays to assess when someone's had an Achilles rupture, because clinically, they already know. They've done their sideline exam. They know if that tendon is torn or not. But the tear might be from the bone avulsing off with the tendon as opposed to the mid portion of the tendon itself. And you can also tear up near the myotendinous junction, but typically it's going to occur here in this watershed zone where there's not as good of blood supply. So again, looking at it one more time here with Harris, remember as he steps backwards, we're going to have eccentric loading on a maximally dorsiflexed ankle. That load cannot be maintained by the Achilles, and we see that unfortunate pop with that release of energy from the recoil upwards. Let's talk next here about CeeDee Lamb, because I'm not trying to be dramatic here. CeeDee is extremely fortunate that he did not dislocate his ankle, fracture his ankle because of the mechanism of what happened here. We saw CeeDee, of course, go back into the game. He then came out right away after just one play. But what we're dealing with for Lamb is the mechanism that would concern us for a high ankle sprain. We're going to look straight on here first to see the position of his ankle as he gets tackled here by this Bears defender. So remember, we're looking at Lamb's left ankle. As he comes down here, we're going to see that left foot get planted into the ground, and then this is that externally rotated position. The one thing that I think saved him here from a more severe injury is it didn't look like his ankle was quite as dorsiflexed or brought upwards like we talked about with Harris. That dorsiflexion, the toes being brought upward, locks the ankle mortise a little bit more strongly and securely, which can put it at a higher risk of a more significant injury because you're putting all the load more so through that high ankle syndesmosis. But then as this continues, that foot externally rotates. What that's going to do is it's going to push the tibia, push the fibula apart from one another that are maintaining that ankle mortise and put stress on that high ankle sprain ligament called the AITFL. Stands for anterior inferior tibiofibular ligament. So then as the play continues here, again, all that maximum external rotation, you're going to have some eversion there that's going to stress the deltoid ligament complex on the inside as well. Those are all what we see whenever somebody has a high ankle sprain. You also have to watch for MCL injuries. You can see the awkward position of his knee, and so MCL injuries can also occur. Same sort of thing from this backside position. Again, I think what saved this from being more severe was the fact that he wasn't quite all the way loaded into dorsiflexion whenever the load came in. There's just as much eversion with his ankle going inward, but this position right here, I think if this Bears defender had more of his weight on the leg and not just the back of his right lower leg coming down on him, CeeDee very well could have broken his leg, broken his ankle, and had a dislocation here, similar to what we saw with Dak Prescott. But that position, again, you're stressing the high ankle. You're also going to be stressing the MCL of his knee. Based on what we saw them examine, they're certainly more concerned about his ankle at the moment than they are his knee. But I would be prepared for either to pop up and be contributing, but at a minimum, the ankle. They showed this picture of his foot on the broadcast. What we're looking at here is going to be the outer part of his ankle, and that's right at the area where you're going to see that high ankle sprain area. So definitely concerning with that amount of swelling that we're seeing right away. For CeeDee, I fully expect x-rays. I'm sure they're going to get an MRI. The ultimate treatment for a high ankle sprain is dependent on, number one, is the joint stable. So when we look at that tibia, the fibula coming down around the talus of the ankle, whenever you stress the ankle, does it widen? Does it gap apart, suggesting there's instability from a full tear of that ligament? If there is, that's a tightrope. That's somewhere anywhere, 4 to 6 weeks on average for somebody like a wide receiver, not a season-ending injury. If this is a mild or just a moderate high ankle sprain, you're probably still looking at about 3 to 4 weeks, best case scenario. So unless they get back and find it's a complete tear, he's unstable and he needs surgery, this is probably still going to be on the shorter side, maybe a move to IR, but we'll see when they get the rest of their testing here. So unfortunate for Najee Harris. I think, again, video clearly shows what looks like an Achilles rupture. For CeeDee Lamb, I would not be surprised at all if we see him miss about a month, if not longer, and go on the injured reserve. That's it for the videos, everybody. Let me know, as always, any questions or comments down below. Let me know, again, what you think of the new looks here. We'll keep kind of modifying, fixing some of the lighting. I need to kind of brighten some of this up and fix what I'm doing when I adjust the scenes, but a little bit cleaner. I like the looks of it a little bit better, so let me know, and I'll see you in the next video. Bye.